Hi everyone, my name is Emily Nelson, and this is my debate for POS 465. Today, I will be arguing for debate number 2, that the World Health Organization has been an effective IGO to address COVID-19 and other global diseases. I will be using this PowerPoint to share some key facts, as well as address concerns related to skepticism and criticism faced by the World Health Organization. So, in simple terms, the World Health Organization has been effective in addressing global crises. Why? Well, let me explain. To start off, the WHO was founded in 1948 and is an organization of 194 member states, a few being the United States, China, India, United Kingdom, and many other countries. In addition, there are smaller countries and islands like Fiji, Ethiopia, the Bahamas, and Uganda. Having so many different countries, both big and small, allow for a rounded and versatile organization that is committed to providing health, safety, and serving the vulnerable. For over 75 years, this IGO has focused a variety of different global diseases and crises, the most recent one being COVID-19, which was a global pandemic that started in early 2020. Per the WHO's website, they have a very important role in global health, stating that they have a triple billion target, which consists of 3 goals. First, 1 billion more people benefiting from universal health costs. Second, 1 billion more people better protected from health emergencies. 3, 1 billion more people enjoying better health and well-being. This triple billion target goal exists primarily to bridge the gap between inequalities in global health systems by focusing on increasing universal health coverage, better protection from health emergencies, and overall better health and well-being, specifically in underdeveloped, developing, or low-income communities. This goal further strengthens the WHO's mission statement of accountability to improve global health. To obtain their triple billion target goal, the WHO has 6 different programmatic divisions to contribute to the success of these goals. These divisions include universal healthcare coverage, access to medicines and health products, antimicrobial resistance, science division, and data analysis and delivery for impact. Next, I would like to discuss a specific crisis, specifically on focusing on COVID-19, as it was the most recent and highly impactful event of our generation. This graph you're seeing here is published by the Pew Research Center in November 2020, which was early pandemic. It illustrates global responses regarding the World Health Organization's handling of the COVID-19 pandemic. Among the 14 countries surveyed, 12 reported that half or more of their populations believed that WHO had managed the pandemic effectively. In addition, countries that had a more favorable view of the United Nations were more likely to see the WHO's positive response to the COVID-19 pandemic. Lastly, tying into our class material and what we talked about so far about international organizations, it's important to note that the World Health Organization has its strengths and weaknesses as shown here. Personally, I believe that an organization as large as the WHO is bound to make mistakes. However, that does not discount its effectiveness as an organization as a whole. However, I would still like to address both strengths and weaknesses. One of the WHO's biggest strengths is their global reach and resources. Being a large IGO, they have almost infinite resources, both monetary and expertise. Which leads me to my next strength of high expertise. According to their website, the World Health Organization has over 800 professionals, including doctors, epidemiologists, scientists, and managers. The combination of large and impactful people in the community coming together to contribute to the goals of the organization shows their impact. One of the World Health Organization's biggest weaknesses is that it has limitless enforceability power. While they provide positive impact on global health, they lack the guns to enforce their policies. For example, during the COVID-19 pandemic, they worked with the CDC to provide recommended guidelines we all remember well: mask mandates, social distancing, and vaccine awareness. However, people had a choice not to follow recommendations. While this is not exclusively a WHO problem, it does reflect on them as an organization overall. Despite the weaknesses that inevitably exist, the WHO has made great strides to reduce global suffering, increase health, well-being, and promote overall well-being, and continue to make a better society overall. For these reasons, I believe that the World Health Organization has been an effective IGO in addressing global crises such as COVID-19 and other diseases. And here are my references. Thank you.